Hi, in today's video we will be discussing about mucormycosis or the black fungal disease. We will be covering mainly the clinical findings and the lab diagnosis and broad guidelines of treatment. So this particular virus, mucormycosis, is now become a notifiable disease as per today's newspaper, and a lot of attention has come towards this particular fungus, especially due to this COVID-19 situation. So let us now look at the what this fungus is all about. The learning objectives are to classify fungal diseases, list the clinical signs and symptoms of mucormycosis, to describe the morphology of mucormycosis and the lab diagnosis. What are fungi? Fungi are non-motile, eukaryotic organisms with rigid cell walls and a classic cell nucleus. If they are multicellular filaments, we call them mold. They are multiple. And if they are single cells or chain of cells, we call them yeast. The fungal infections in general are called as mycosis. Based on the classification, the primary site of infection, they can be superficial, cutaneous involving the skin, subcutaneous beneath the skin. They could be endemic or localized to a certain area, or systemic, spreading all over the entire body, which can be primary and opportunistic. Opportunistic word we use when the immunity of the body is low and the fungus tends to invade them. Coming to zygomycosis, which is nothing but the mucormycosis, also called the phycomycosis. So rhizopus, Apsidia, Cunningamella, mucor are all zygomycetes. And what are the predisposing factors? When do they actually involve the patients? They involve the patients if the immunity of the body is low. Right? First thing, the immunity will be low, and there will be some other factors such as neutropenias. If there are chemotherapeutic drugs which are given to reduce the neutrophil counts, or the patient is on steroid therapy. Steroids tend to reduce the immunity by suppressing inflammation. All sorts of inflammation is suppressed. Therefore, again, as the immunity is low, the patient is susceptible to fungal infection. Diabetes, breakdown of cutaneous barriers such as the skin when there is burns, surgical wounds, trauma. Now, of late, the attention has focused to COVID-19, right? So we are all worried and puzzled why it has happened. Well, it is not puzzling because in COVID-19, indiscriminately we are using, or not indiscriminately, I would say, as a life-saving measure, we are using steroids. And when we are using steroids and the patients tend to be diabetic, then you can have mucormycosis on the rise. So pathogenesis, they are airborne, they are asexual spores, they involve the sinuses. Sinuses are these areas, paranasal sinuses, they involve the lungs, they involve the gastrointestinal tract, and they are proteolytic and lipolytic enzymes, and they have mycotoxins, which are the fungal toxins. Now, this mucormycosis is of three types: rhinocerebral mucormycosis, that involves the CNS. It can involve the sinuses, the central nervous system. They cause local tissue necrosis. They invade the arterial walls. They penetrate orbital tissue, cranial vault, meningoencephalitis, thrombosis, and cerebral infarction. They invade the CNS. That's why we are very worried about them. They are angioinvasive. Normally, if the immunity is good, there is nothing to worry. When the immunity is compromised, these fungi tend to invade into the blood vessels. They can involve the lungs, secondary to rhinocerebral disease, or primarily in patients with hematologic neoplasms. This manifests in the form of hemorrhagic pneumonia, vascular thrombi, and distal infarctions. Then they can involve the GIT and lead to black necrotic ulcers with local vascular occlusions and ischemia. So how does this look? It's also called as zygomycosis, and the diagnosis is made by a tissue biopsy. So within the blood vessel, the wall of the blood vessel, you find these broad non-septate hyphae, 6 to 25 microns, with irregular non-parallel contours branching at right angles. If you can see this red structure here, this is the mucormycosis, and it is wrinkled or collapsed, right? And next, this is the clinical presentation taken from the journal, just to show how grossly the fungal infection looks. It is blackish, discolored, right? Next, again another photomicrograph showing the broad hyphae. These are the hyphae which are at 90 degrees angle. Another microphotograph borrowed from one of my colleagues. This has been reported recently from a COVID-19 patient. And so we have to remember Mucor is not the only fungus. There are also other fungal infections which can affect COVID patients, or it can also affect other scenarios. So the common differential diagnosis is Aspergillus. So Mucor has broad hyphae, Aspergillus has thinner hyphae. Irregular branching is seen in mucormycosis, regular septations in Aspergillus. Some branch at 90 degrees, and whereas there is 45-degree branching or dichotomous branching in Aspergillus. What are the possible reasons? Still it is speculative because I cannot say with surety, but yes, there is increased use of steroids predisposing to fungal infection. It could be a risk factor. Comorbidities like diabetes mellitus could also contribute to the COVID-19 situation and the mucormycosis. Special stains for Mucor are PAS stain and the GMS stain. Treatment guidelines, so systemic antifungal drugs like amphotericin B, isavuconazole, posaconazole are used, or surgical treatment is important to remove the infected or dead tissue to keep the fungus from spreading. With these broad guidelines, I think I have just given an overview. And so what am I trying to conclude? I'm not trying to conclude anything right now, but what I'm trying to say is please do not use steroids without medical guidance. That is one message I would surely give you. If you are a patient of COVID-19, consult a doctor, right? Do not start treatment on your own. Do not take treatment on your own. Consult a doctor. It could be a family physician. It could be a video consultation, but do consult a doctor and get the right treatment, because treatment is tailor-made according to the age and triaging. Alright, stay safe. I hope we all are safe in this pandemic, and do subscribe to this channel. Thank you so much.